Okay, ready? Okay.
Wait, on me?
Yes.
Yeah, I'm gonna do it on you. Okay, we're here with Elaine Therapy. My name is Dave Butler. I'm a physical therapist here and the owner. I want to talk about dry needling today. Dry needling is something that we've done more recently over the last year, and we're seeing great results with it. So I thought I would explain it a little bit. My wrist is hurting today, so I'm going to do some dry needling on my wrist. I've never actually poked an acupuncture needle into my own body before, so let's see how this goes. Unless Jake wants to be the model. Jake, do you want to be the model? No? He doesn't want to be the model. So I'm just going to demonstrate with a few things. First of all, we use acupuncture needles. They're really small, really teeny needles. And we just put them into the muscle tissue and into some of the other areas of the body. And we're having great results with a few things. So first, I'm just gonna put this needle right in here. All right, I'm not crying yet, Jake. So we're gonna take that needle, filling that a little bit. So, little needle right in there. We do use some points that are very similar to acupuncture needles. Go out, you're gonna faint. Tessa, my daughter, does not like needles or anything like that. So I got one in there. We're gonna do another one right here. It's really not that bad doing it on yourself. I'm actually a little surprised.
Oh, that looks so gross.
Okay, so we've got 2 needles in. I'm not feeling faint yet. I'm not fainting. Jake's about to faint. But the reason we do acupuncture, well, not acupuncture, the reason we do dry needling, it's different than acupuncture. Acupuncture, where they look at the meridians of qi and try to free up the flow of qi in the body. With dry needling, we're trying to hit specific areas that are tight, like trigger points, tendon tissue that needs to heal, things like that. In my wrist, I have some tendinitis, and I have tendinitis quite frequently. So I've never done dry needling on my wrist, and I'm curious how it does. These needles are very small, but they create a little bit of inflammatory process when they're in the body. They also have some other effects on the healing process of the body to try and stimulate healing throughout the tissue. So let's see, what other one do we want to do? We're not going to do that one. Let's do...
One purple?
We're going to do one right here. Right in between those 2 bones right there. And the idea is to get into the muscle tissue and try to get...
Can you feel it?
It's a little weird doing it on yourself. But we're trying to get into the muscle tissue. And sometimes we're trying to create a twitch response that the muscle twitches and then relaxes. It's a little more complicated than that, but we can think about it that way. After we put needles in, we'll also move the needles around sometimes into the muscles, or we'll twist the needles a little bit to wind up the collagen tissue along the needle, kind of like a fork in spaghetti as you wind it up. What was that? So you wind it up a little bit to try and stimulate that collagen tissue to remodel and get loosened up, basically. So there's, I need you to open one of those, Jake. So let's see, what else do we want to do? So there's a one spot here on the side that I'm gonna do one in. Okay.
Can I put it?
No, you're not gonna put it in. So can I put it in? We're gonna go right here.
Oh! Is that bad place?
Bad place? No. I'm gonna go right into that muscle right there. Woo. Am I sweating yet, Jake?
Yep.
I'm sweating? Open me another one of those. So we're going in specific spots all around the hand, and There's no real specific spots that we do all the time, but we're trying to contact the tissue that is more involved. No, don't touch that. He's going to be sticking needles in himself. Let's not do that. So we're going to put one right there. Ooh, this one's going to hurt. All right. So we're going to take that one's where my problem is. So we're going to take that down a little bit. Oh, hit the bone right there. Okay, Jake, I need another one.
How do you know that?
Because I can feel the bone. I can feel when it hits the bone.
Oh.
So we're going to go up a little bit.
If anybody does dry needling on me, I'm going to be like creeped out.
Why are you going to be creeped out?
'Cause it's gross.
It's not gross.
It's like all the way in your skin and like touches the bone and it like scrapes it.
So these are the areas I have problems with tendinitis. So
Hey Dad, are you going to shock yourself?
I can move the needles as I move my hand. Well, that's really kind of weird, actually. So,
Cool.
give me another one.
Okay.
So there's kind of a response after you put a needle in that's kind of like an aching sensation into the tissue. Some people call it a de qi response. In Chinese, it's called the de qi response. You're receiving the qi, like duh. And we want that response. That's your body's response that helps to release opioids and other pain relieving factors into the body and help with pain relief. So again, we stimulate those needles to try and create more of that response, but we also will sometimes hook up to electrical stimulation, and that electrical stimulation will stimulate the tissue through the needle. It's kind of fun, but maybe it's fun for me as a therapist, but it helps. We're having great results with people with tension in the neck, tension in the back. The upper back responds really well. Tennis elbow responds really well. We're seeing good results with shoulder pain, shoulder impingement, or pretty much anything chronic. This isn't something that's for acute problems, something that just happened, like you sprained your ankle. I'm not going to be doing dry needling on that. But, why?
Wait, I said what?
What? Sprained ankle?
Dry needle.
Dry needling. This is called dry needling.
On your what?
Okay. I think we've derailed. So it works great for chronic problems. So if you have a chronic issue that is, bugging you and has been there for a while, and you just can't get to go away, dry needling may be the ticket for you. So subscribe to our channel so you can see other things as we send more videos out, and check out our website and see what other services we have to offer. Dry needling is just one of the tools that we use to get you better. So have fun. I'm going to pull these out in a second. Hopefully I don't scream or Jake faints. And good luck.